In the previous video, we learned about the causes of hemoptysis. In the second video, we will learn about the assessment and management of hemoptysis. Assessment of hemoptysis. From history, we ask two things: the amount of sputum and the appearance. Amount: blood loss of 400 ml in 24 hours or 100 to 150 ml expectoration at one time is considered as massive hemoptysis. Appearance: if the sputum is serous, frothy, pink, it can be due to pulmonary edema. If it is mucopurulent, it can be due to bronchial or pneumonic infection. If it is bloodstained, it can be due to carcinoma, tuberculosis, bronchiectasis, or pulmonary embolism. Then we ask for any associated symptoms. If hemoptysis is associated with fever, night sweats, and weight loss, it can be due to tuberculosis. If it is associated with finger clubbing, it can be due to bronchial carcinoma and bronchiectasis. If it is associated with fever and sign of consolidation and pleurisy are present, it can be due to pneumonia and pulmonary infarction. If it is associated with leg edema, as in deep vein thrombosis, it can be due to pulmonary infarction. If it is associated with cachexia, hepatomegaly and lymphadenopathy, it can be due to malignancy. Initial investigations for hemoptysis: if the patient is not having any massive hemoptysis, we can go for the sequelae of investigations, which are complete blood count, in which we try to assess for any infection, anemia, thrombocytopenia. Then we check the coagulation parameters. We do the measurement of the electrolytes. Then we do chest X-ray to find out any cavitation is present or not. Then we do CT if there is any risk of malignancy or if there is any history of smoking. And then we do urine RME to find out if there is any pulmonary renal disease, glomerulonephritis, etc. In management of hemoptysis, three things needed to be achieved for immediate purpose, that is protection of the airway, location of the site of bleeding, and control of bleeding. And number four management is treatment of the cause. Then if we have hemoptysis but the chest X-ray shows normal, what is the DD? The differential diagnoses are endobronchial carcinoma, bronchial adenoma, cryptic tuberculosis, bleeding disorders, vasculitis, and anticoagulant therapy. Thank you.